Hi, today's presentation is focused around nutrition for bone health. My name is Ashley and I am a dietetic intern with UIC, currently completing my rotations to become eligible to sit for the RD exam and become a registered dietitian nutritionist. One of my favorite things to focus on is eating foods that can keep us healthy. Today's presentation is going to focus on bone health information, nutrients that affect bone health, including types of nutrients, the amount of those nutrients that we need, what those nutrients do for our bones, and foods that contain those nutrients. We're going to discuss also how the food we eat can help bone health. The objectives for this lesson include being able to state the need for nutrition focused on bone health, being able to name common foods that can help with bone health, and being able to determine one easy way to incorporate nutrition for bone health in daily living. A little information about our bones and bone health. Bones are made up of protein, collagen, and a mineral component that provide rigidness and flexibility. When bone lacks a mineral component, bones can lose some of their rigidity and get soft. Bones store some minerals, and they are reserved for calcium and phosphorus in particular. When blood levels are low in calcium, the body may pull from the bones to maintain appropriate levels. Bones are constantly undergoing changes of remineralization and demineralization, meaning they're constantly getting broken down and building it back up again. Some common bone health disorders include osteoporosis, low bone density, and osteomalacia. Osteoporosis weakens the bones and increases the chance of bone breaks. The main cause is long-term low calcium levels. Low bone density increases chance of bone breaks. Osteomalacia is softened bones that can lead to fractures, and the main cause is vitamin D deficiency. So what can we do? Regular bone density screenings allow us to be aware of our bone condition. And then we can be careful of slips, trips, or falls to avoid breaking any bones. Some things about bone health is that peak bone mineral density is in early adulthood. Many things that impact bone health are outside of our control, such as age or gender. As we age, it becomes more difficult to increase remineralization, and this is more true in females than males. Hormones also impact bone health, especially in females. After menopause, women are at higher risk because of the hormone shifts. Some disease states inhibit absorption of nutrients that affect our bone health, and some medications inhibit absorption of nutrients that also affect our bone health. The good news is, because bones are constantly under construction, there are many things we can do to help them stay strong, including nutrition, where there are several nutrients in our diet that can help increase remineralization to keep bones strong. Physical activity, being active, especially in load-bearing activities, even low impact such as walking, helps bones increase strength. And lifestyle factors that are in our control, such as drinking or smoking, excessive alcohol intake, and any cigarette smoking negatively impacts bone health. The main nutrient that we think of when we think of bone health is calcium, and this is the primary nutrient we use to build up bones for the mineral component of bones. And as previously mentioned, calcium is stored in our bones. The daily recommendations for calcium is 1,200 milligrams per day, and it's advised to spread that out over 3 servings per day. Calcium absorption is negatively impacted by anti-gastroesophageal reflux disease, or GERD, medications, spinach and chard, legumes, and whole grains. Some of these foods contain a compound that wraps around and binds with the calcium before it can be absorbed. Calcium absorption is positively impacted by vitamin D and protein. Some calcium-rich foods are some we normally would think of, such as dairy products as milk, yogurt, and cheese, fortified cereals and fruit juices, dark leafy green vegetables like collard greens, turnip greens, kale, bok choy, fortified plant-based beverages such as almond milk or rice milk, white beans, and canned fish with soft bones. An 8-ounce glass of 2% milk contains 285 milligrams of calcium. A half cup of white beans contains 96 milligrams of calcium, and a half cup of kale contains 90 milligrams of calcium. Another nutrient we commonly associate with bone health is vitamin D. Vitamin D helps calcium absorption. It helps keep bones, teeth, and muscles healthy. In certain disease states such as Crohn's disease, cystic fibrosis, and celiac affect the intestine's ability to absorb vitamin D. The daily recommendations of vitamin D are 800 international units IUs, or 20 micrograms daily. Some foods rich in vitamin D include fatty fish, such as salmon, eggs, fortified foods and beverages, cheese, and sunlight exposure. 15 minutes in full sunshine can provide a full dose of vitamin D, and this is very hard to do in Illinois during much of the year. Half a fillet of salmon includes 815 international units of vitamin D. 1 egg contains 44 international units of vitamin D, and 1 ounce of cheddar cheese contains 7 international units of vitamin D. Now we'll go into lesser-known bone health nutrients. Our first is magnesium. Magnesium works with calcium to keep bones healthy. It contributes to bone's density and the mineral component of bones. Over 60% of magnesium in the body is found in our bones. The daily recommendations for magnesium are 420 milligrams per day for males and 320 milligrams per day for females. Foods rich in magnesium include many foods with fiber, leafy greens, legumes, nuts and seeds, and whole grains. A half a cup of sunflower seeds contains 227 milligrams of magnesium. 1 cup of kale includes 31 milligrams of magnesium, and 1 slice of whole grain bread contains 23 milligrams of magnesium. Our next bone health nutrient is phosphorus. An important function of phosphorus is to form bones and teeth. Phosphorus and calcium make up the largest part of the mineral component of bones. The daily recommendations for phosphorus are 700 milligrams per day for males and females. Those with kidney disorders should follow doctor's orders for phosphorus intake. Foods rich in phosphorus include dairy products, meats, beans, eggs, nuts, fish. Many additives in food contain phosphorus, and it is widely found in our diet. A half a cup of chicken contains 150 milligrams of phosphorus. A half a cup of navy beans contains 125 milligrams of phosphorus. 6 ounces of Greek yogurt contains 240 milligrams of phosphorus. Our next bone health nutrient is Potassium. Potassium may help reduce calcium loss from bones, and dietary recommendations for potassium are 3,400 milligrams per day for males and 2,600 milligrams per day for females. Once again, those with kidney disease should follow their doctor's orders on potassium intake. Foods rich in potassium include fruits, vegetables, beans, and dairy. One medium potato contains 897 milligrams of potassium. One medium banana contains 422 milligrams of potassium. 1 cup of avocado contains 708 milligrams of potassium. Are you surprised to see many of these have more potassium than a banana? Our next bone health nutrient is vitamin K. Vitamin K is a group of fat-soluble vitamins that help bone metabolism. They help regulate blood calcium levels. Daily recommendations for vitamin K include 120 micrograms per day for males and 90 micrograms per day for females. And you should follow your doctor's orders if you're on any blood thinner medications. Foods that are rich in vitamin K include green, leafy vegetables such as kale, fish, meat, eggs, and cruciferous vegetables such as Brussels sprouts or broccoli. Half a cup of cooked kale contains 499 micrograms of vitamin K. One large egg contains 5.8 micrograms of vitamin K, and half a cup of cooked Brussels sprouts contain 109 micrograms of vitamin K. Our next bone health nutrient is vitamin C. Vitamin C not only helps our immune system, but vitamin C helps our body form collagen, which is the foundation for bone mineralization. The daily recommendations for vitamin C include 90 milligrams per day for males and 75 milligrams per day for females. Foods rich in vitamin C include fruits, especially citrus fruits, tomatoes, vegetables such as bell peppers, potatoes, and Brussels sprouts. 1 cup of cherry tomatoes contains 20 milligrams of vitamin C. 1 small orange contains 51 milligrams of vitamin C, and a half a cup of red pepper contains 116 milligrams of vitamin C. To sum it all up, our bones are constantly under repair, which means we have the ability to affect our bone health every day. Nutrition for bone health includes a varied diet, which includes fruits, vegetables, whole grains, seeds, nuts, meat, seafood, and dairy. A balanced diet with variety provides all the important nutrients for bone health. Adding in foods rich in calcium and vitamin D spread throughout the day is a great place to start. Final note is that in general, it is best to get nutrients through whole foods, as our foods contain a variety of benefits. As mentioned earlier, there are many reasons why nutrient absorption would be negatively impacted, and supplementation may be needed. If your doctor or dietitian has recommended supplementation, you should follow their orders. I hope you enjoyed this lesson on bone health, foods and nutrients that we need for bone health, and ways that we can incorporate those foods into our daily lives, and ways that we can positively impact our bone health. Thank you and enjoy your day.
Hello, my name is Malik Steward. I'm a dietetic intern at UChicago Medicine Ingalls Memorial, and today I'm hosting a lunch and learn about oral health. So, what is oral health? Is oral health even important with maintaining a proper nutrition? So, I'm going to start with some definitions and a brief beginning so you can understand what it is. The overall cavity, oral cavity, is the beginning of the gastrointestinal tract. It begins the process of digestion. An assessment of the oral cavity is vital for determining if the patient can adequately bite and chew with anterior and posterior teeth, respectively. So, to break it down a little bit more, it's basically saying that your oral health is when you have your teeth and the process of chewing and how actually you're able to do so. Do you have any dentation problems? Do you have missing teeth? Do you have dentures? What way do you chew your food? So, what is oral health continue? It's by following proper mastication, which is chewing. The ability to form a bolus and swallow are necessary for adequate dietary intake and optimal nutritional status. Thus, assessment of dentation, quality and quantity of saliva. It may be part of the intervention and monitoring and evaluation of the nutrition care process. So, when your dietitians come in and they do assessments on you, they should be looking at your teeth as well. Assessing your mouth, your gums, if your ability to make saliva will determine what type of diet you should be placed on. So, why is oral health important? Oral health is an often overlooked aspect of older adults' overall health status. Nutrition and diet affect the oral cavity. Anything you put into your mouth actually does affect your oral cavity. It may affect the ability to consume an adequate diet and achieve nutritional balance. Oral health is related to systematic health and overall well-being in older adults. So these are some main contributors to poor diet that will cause a poor oral health status. Poor oral health has been shown to contribute to compromised diet quality and inadequate intake. Those with partial or full misindentation, ill-fitting dentures are at greater risk of nutritional risk. Tooth loss, use of either full or partial dentures. Exostomia can lead to difficulties in chewing and swallowing. In the previous slide, I stated exostomia, in other words, dry mouth. Common side effect of more than 400 medications. Xerostomia may also occur as a result of dehydration, autoimmune disease symptoms, or undetected damage to the salivary glands. Taste sensation and saliva production are also diminished, making eating less pleasurable. These are the instances where you will see many people having more liquids in their diet, gravies, and broths to help ease the dry mouth. So some of the key issues with bad oral hygiene and oral health in aging adults is root decay, gum disease, uneven jawbone caused by tooth loss, denture-induced tissue inflammation, overgrowth of fungus in the mouth, also known as thrush, attrition, which is loss of teeth structure by mechanical forces, or oral cancer. Oral health risk factors in aging adults. So some of the main risk factors you should look after are altered taste, autoimmune diseases, cranial nerve disorders, inadequate diet, masticatory compromise, oral infections, osteoporosis, polypharmacy, poverty, substance abuse, type 2 diabetes, ulcerations, lesions in the mouth, unintended weight loss, xerostomia, lack of Medicare coverage for dental care, root caries, and decreased pleasure of eating. All of these factors will make it more likely to have oral health risk factors. So what ways can nurses and dietitians actually help you if you do have oral health issues? So you can include oral health screening exams as part of nutrition assessment protocols. So we'll make sure that in our nutrition assessment, we're actually having you open up your mouth, pull out your tongue, and we'll assess to see if there's any more underlying issues. Maximize oral intake of nutrient-dense foods. Involve the older adult and caregiver's family. So this should be a collaborative approach. It should not just be from me to you. You should tell your children, parents, friends, family, anybody that will be around you and will actually give you food or drinks or beverage. It's something that you will want to make sure they're educated on too, so they can help prevent the likelihood of developing oral health issues. Referrals to dental professionals as needed. And for exorostomia, encourage moist, temperature foods and limit salty or dry foods, which may dry out the mouth even further. Some other ways of combating oral health is encourage frozen grapes if no chewing or swallowing difficulty is present. So only on a general 7 diet will this be allowed. Or other fruits with high water content, such as sugar-free lozenges, mints, and gums made with xylitol. Modify texture as needed. Moisten foods with gravies and sauces. Cut foods into smaller pieces, and encourage regular oral hygiene. Make sure you floss once a day, brush your teeth twice a day. Keeping these in your everyday habits will definitely help fight bacteria and decrease the likelihood of oral health issues in the future. So, nutrition care. During nutrition care, the RD should make sure that they have inspection of the oral cavity as part of nutrition-focused physical assessment, as stated before. And while doing so, the registered dietitian will be inspecting for the mouth to observe for missing, broken, or decaying teeth. Nutrition care. So during the assessment, you will have to make sure that you remove your dentures or partials so we can see your gums and make sure that those are healthy, which hold your teeth steady. A complete inspection of the oral cavity could then be completed, which will include inspection of the mouth surfaces for areas of irritation or suspicious lesions, traumatic ulcers, denture stomata, and other oral problems. So what are some tips and tricks that you can do on your own or tell others to help out if you already have oral health issues? So you'll eat meat with gravy or sauce. You will cut meat into very small pieces, about the size of a fingernail on your thumb. If small pieces are also difficult to chew, then put the meat into a blender or food processor and grind for easier chewing. Remember to clean blending equipment with hot soapy water to remove bacteria. This is very important, and making sure you're using clean, sterile dishes and utensils will also help with decreasing the likelihood of poor oral hygiene. Some other ways to make sure that you can help along the way with eating a little bit smoother if you have oral health issues are soak dry foods like breads, crackers, or cold cereal into milk until soft enough to chew. Puddings can be a good source of calories and protein in a small serving, but may be sure to rinse your mouth after. Sometimes pudding can get stuck in between your teeth or in your gums, so make sure you swish it out. Foods are recommended. So you want to wash the blender whenever you're using uncooked meat before using for the foods that are eating like raw vegetables or fruits to avoid cross-contamination. All right, and here's a chart for the nutrition care manual. Just to break it off by food groups, so grains and starches, vegetables, fruits, milk and milk products, and meat and other protein foods. So we're going to base it off of the grains. Let's say you have 5 to 6 servings a day, and you get 1 slice of bread. A way to modify this is to dip bread in milk, coffee, or tea. Going to go down to fruits. So let's say you have 1 medium-sized fruit. A way you can modify this is use canned fruit in its own juices like peaches, pears, and fruit cocktail. Vegetables. A half-cooked cooked vegetable. A way to modify this is cook vegetable into soft. Use canned or mashed or puree first. Milk and milk products. So like 1 cup of yogurt. Make smoothies with milk and fruit blended together. Eat cottage cheese, ricotta, or other soft cheeses that can easily be swallowed and not be stuck in the teeth. Now, meat and other protein foods. Let's say you have 3 ounces of meat, about the size of a deck of cards, 1 egg, or some tuna. So first, for the 3 ounces of meat, you will chop meat into small pieces. Eat legumes, beans, black pinto garbanzo kidney beans, and eat soft boiled or baked fish. All right, and here's my sample 1-day menu. So for breakfast, have a half cup of oatmeal, 1 scrambled egg, half banana mashed, 1 cup of non-fat milk. For lunch, 1/8 cup of gravy, half cup of well-cooked carrots, 1 slice of whole wheat bread softened in milk, half cup of fruit cocktail in its own juice, and 1 cup of low-fat milk. For the evening meal, you have 1 cup of tomato soup, half cup of well-cut broccoli, and the evening snack, 1 cup of yogurt, not fruit, non-fruited. Oral health frequently asked questions. So I have 3 questions that I'm going to give you the answers to, but I'm going to have a brief pause in between just to let you think about it a little bit and see if you already know the answers to them. So question number 1, what are some examples of cariogenic foods that should be monitored for caries risk? Okay, so to answer this question, foods that are sugary, chewy, and sticky should be especially monitored for caries risk because of their ability to adhere to the tooth surface. Cariogenic foods also include fermentable carbohydrates, which also should be monitored for caries risk. Examples of fermentable carbohydrates include sugar-sweetened beverages, fruit and fruit juice, crackers, chips, pretzels, cereals, bread, desserts, cookies, candies, and cakes. Advise patients to pair these foods, cariogenic, with cariostatic foods such as protein-containing foods, vegetables, fats, and sugarless gums to decrease caries risk. Question number 2. Should patients be advised to brush their teeth before or after breakfast? Yes, patients or residents should brush their teeth after breakfast when possible. This will reduce duration of tooth exposure to fermentable carbohydrates. If the patient or resident is not able to brush, recommend rinsing the mouth out with water or chewing sugarless gum. All right, and the final question, does switching from regular to diet soda eliminate caries risk? Although there is no sugar in diet soda to classify it as a fermentable carbohydrate, diet soda is acidic. It may promote an erosive environment. Diet soda may be a better choice than regular sugar soda for individuals who cannot reduce their intake of soda. A neutral beverage such as water will be the ideal choice to minimize caries risk from beverage consumption. Some terms to know. Take-home terms to be familiar with. Anti-cariogenic foods. They are foods that suppress the development of caries by preventing plaque from recognizing an acetogenic food. For example, xylitol, sugar alcohol, typically found in sugarless gum. Cariogenic foods. Foods that contain fermentable carbohydrates that cause a decrease in salivary pH to less than 5.5. And demineralization when in contact with microorganisms in the mouth, promoting caries development. For example, sticky, chewy, and sugary foods that can adhere to the tooth surface and fermentable carbohydrates. More terms to know. Cariostatic foods. Foods that have the characteristic of not being metabolized by microorganisms and plaque to cause a drop in salivary pH to less than 5.5. Examples: protein-containing foods such as eggs, fish, meat, and poultry, vegetables, fats, and sugarless gum. Dental occlusion, the bringing of the opposing surfaces of the teeth of the two jaws into contact. How well the teeth come together, especially for mastication. Fermentable carbohydrates. Carbohydrates that can be metabolized by oral bacteria to produce acid during a process called fermentation. The acid produces a drop in salivary pH to less than 5.5 and create the ideal environment for tooth decay in susceptible individuals. For example, crackers, chips, pretzels, cereals, breads, fruit juices, and sugar-sweetened beverages. Here are some recommended oral hygiene health websites, as well as the references that I use today for this Lunch and Learn. So, the Academy of General Dentistry, the Australian Department of Health and Aging, Healthy Teeth, California Child Care Health Program, Centers for Disease Control and Prevention, Oral Health, and the World Health Organization. All of these programs can be Googled. You just put it in Google and it'll bring you directly to the site. I hope you all enjoy this presentation. Please make sure to look at the sample recipe and some of the tips and tricks and other ways of making sure to make oral hygiene a lot easier to deal with. Thank you.